Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for today, October 8th. I'd like to start by acknowledging that we are on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, and we're very grateful to the keepers of this land and to be able to speak from these lands today. So for today, we have a total of 110 new cases who have been diagnosed with COVID-19, including one epidemiologically linked cases, bringing our total to 10,066 people in British Columbia who've been diagnosed with COVID-19. That includes 3,693 people in Vancouver Coastal Health, 5,174 people in Fraser Health, 223 people in Vancouver Island Health Authority, 557 people in the Interior Health Region, 330 people in Northern Health, and 89 people who generally reside outside of Canada. We have 1,394 active cases in the province right now, 76 of whom are in hospital, 17 in critical care or ICU. In the hospitalized patients, 35 are in the Vancouver Coastal Region, 37 in Fraser, 1 in Interior, and 1 in Northern Health. We have 1 new death today in the Vancouver Coastal Health Region, bringing the total number of people who've died from COVID-19 in British Columbia to 245. And our condolences go to this person's family and to their community, and we all express our condolences for this death. We have 3,139 people under active public health monitoring and 8,398 people who have now recovered from COVID-19. There are no new healthcare outbreaks today, and the outbreak that was declared at the Milieu Children and Family Services Society has now been declared over. So that leaves us with 17 active outbreaks in the healthcare system, 14 in long-term care or assisted living, and 3 in acute care. We're now up to 900 cases in our healthcare system, 528 residents and 372 staff. We have no new community outbreaks, and the one that we had several weeks ago at Tech Coal area in the Interior Health has now been declared over. We do, however, continue to have some community exposures and school exposures, and the notifications of those are on both the BC CDC and the Health Authority websites. So since the start of the pandemic here in British Columbia, there's been a lot of focus on our numbers and our daily numbers. How are we doing? How do we compare? What does it mean? And today we've reached a threshold which is one that makes us pause. We have 10,000 people who have been diagnosed with COVID-19 in the province. And we know that that's an underrepresentation of the impact of this virus, and that there have been more people, particularly early on when our access to testing was limited, who have been infected with this virus. And while we are fortunate that our province and our country has fared better than others, this number does give us reason for pause. It's a reminder that many people have been impacted by this virus. We know that 245 families have been impacted at a time when it's very challenging to come together and to mourn and to celebrate people's lives. It is a reminder that we know what we need to do, and we need to continue to do it. To slow down, to think about what we're doing, to make those smart choices every day. Catching it early, isolating people so it doesn't spread, keeping our numbers small, flattening our curve, which we have been doing. But as we have seen before, that can change very quickly. So please, no matter what the numbers may be, thank you for all you are doing, everyone in British Columbia, and we need to continue to support each other to keep doing our part. I have received some questions, many questions, but many recently about businesses and what we should be doing or what they should be doing if somebody on their team tests positive for COVID-19 or is homesick and is waiting for testing. So much of what is required is determined by how long they were in that workplace, how close they were to others, the types of activities that you were doing, where it occurred. So it isn't a clear answer, unfortunately, but it is important for all businesses to know that you're not alone and you don't have to figure things out on your own. Public health teams will be and are there to assess the risks, to provide guidance, and to help you with what you need to do should somebody on your team test positive. But there are some things that businesses can do and should be doing every day for the health of your employees and also for your business. One of the best things you can do to protect your business is to make it easy for people to stay away if they are feeling ill, whether that, for some people, it's possible they could work from home. For others, it may mean taking time off. That means in most cases, your business can continue without interruption. To do this, though, everybody needs to be aware of and know the symptoms of COVID-19, and as we're heading into respiratory season, this is an important time to remind people so they can arrange to get tested if symptoms develop. And there are lots of resources we have that can support businesses of all types on the BC CDC website and on WorkSafe BC. And we've put together guidance to help you, and there's numbers there that you can call to get advice about how to do this. You should also have symptom screening as part of everybody's workday. This should happen before we come to work, but also a check when people arrive is also a good idea. Another thing you can do is pay close attention and track who is on site on particular days, where they are working, who they are spending time with. And that may be leaders in different areas, keeping track of who's with who, keeping meetings mostly virtual if you can, making sure that when you are, the staff are together, that you're maintaining safe distances, maintaining smaller groups of people that see each other on a regular basis, making sure you have those barriers in place for when people need to come together, and you have minimum numbers of people depending on the size of the room. This goes a long way to supporting rapid contact tracing as well, should it be required. Just as we have our personal layers of protection, I encourage all businesses to regularly look at what you're doing to ensure you are doing all you can to keep COVID away and to know what to do should somebody test positive in your team. So now's a good time to review your COVID safety plan and to talk to the experts at WorkSafe BC if you need some help. I know many people as well are looking forward to the upcoming long weekend, and we've talked about this before. But let's make this Thanksgiving weekend one of gratitude, one of kindness, and we do that by staying local, connecting with each other in a way that doesn't put those we care about at risk. The impact of COVID-19 has been significant across the province. Yet there is very great things that we can be grateful for. We can give thanks and continue to find new and safe ways to support each other and show we care. Support your family by keeping your celebration dinner small. Support your friends and neighbors by always giving them the space to stay safe. Support our public health teams by paying attention to how you are feeling and always stay home if you're feeling ill. And if you're out and about and you can't keep your safe distances, it's important to wear a non-medical mask. What we do today and every day makes a difference, and we've seen that. We've seen that in the progression of our pandemic here in BC. We need to all continue to do our part, and we also need to remember that this continues to be our time to be kind and to be calm and to be safe. Thank you, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to reporters on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. Please also unmute your phones. You will not be audible until your name is called. First question is from Shannon Patterson, CTV.
Hi, Dr. Henry. My question is actually about flu shots. Some Metro Vancouver pharmacies are now, just today, getting their first doses and starting to vaccinate people. The ones I spoke to said they have never seen a demand like this before. It's unprecedented. Getting an online appointment right now is basically impossible. Do you have any concerns that there will be enough flu shots considering the demand that's out there?
Yeah, well, we hope so. This is something we've been paying attention to since way back in February. We have a process in Canada for global purchase of influenza vaccines, and when we saw what was happening in the Southern Hemisphere, where their influenza season started in April and May, we ordered extra vaccine this year. We have had no delays in the manufacture of vaccines. That happens sometimes, some years. So we're confident that we have, some of it has started to arrive already. The most of it will come in the coming 2 weeks. And the ideal time to be immunized, as you say, is in the end of October into the early November. So we expect that we'll see much more vaccine available across the province. It's distributed across the province right now, and we're starting to get it out there. There'll also be both physicians, pharmacists, public health clinics. We have a plan to make sure that we can safely get a vaccine to as many people as we possibly can this year, and to do it in a way that makes sure we're not putting people at risk for COVID as well. So it is an important year for people to protect themselves from influenza. This vaccine doesn't protect you from COVID, but it does make sure that you're not going to get infected with influenza, or it goes a long way to help that, which means that we reduce the pressure on our healthcare system. So this is, if any year, the year you should get your vaccine, and it should be available in the coming weeks for everybody who wants it.
Do you have a follow-up, Shannon?
Yeah, do you think that right now, with this big rush that's starting, should healthy, relatively younger people maybe wait and allow the older or more at-risk population to book the appointments now? Because as I said, I went on the London Drugs online portal and there are no available appointments. It seems like everyone is rushing now, but would you suggest maybe healthier people can wait a few weeks? There's no need to panic?
I think that's a very good advice, yes. There will be lots of vaccine available, and it'll be coming over the next few weeks. So it is important for those who are most at risk, or for healthcare workers, people who are spending time with people who are most at risk, to be immunized first. Those are the people we would encourage right now. We do have special clinics for people in long-term care as well as for healthcare workers. But yes, this is the time when we should be deferring to our seniors and elders in the community to make sure they're protected as well.
Next question is from Graham Woods, Glacier Media.
Oh, hi, Dr. Henry. On the BC CDC website, it talks about how children are at low risk of catching and spreading the disease, that children who develop it are less likely to spread it than adults. With the rising cases, the percentage of cases with kids, can you kind of speak to the research that has led to that assumption or conclusion that children are not they don't spread it as much as adults?
Yeah, so this is an ongoing area of research and investigation around the world. And the paper that you're referring to, there's a number of them up there on the BC CDC website. We do what are called rapid evidence reviews. We align with what we see from other agencies as well, and collectively around the world, there's a reference list in that evidence review that you can look at what some of the papers are. But the evidence shows particularly young children under the age of 10 are much less likely to shed virus, much less likely to have severe illness, and less likely to pass it on. And that still holds. We know that as children get older, there's no magic age, so it depends on the child, and we can't say these things categorically. But as we get older, we're more likely, so teenagers are more like younger adults, still lower risk. And a lower percentage of the cases relative to the population. So we've been monitoring that quite carefully, looking at the percent of the population under the age of 10, the numbers of kids who are getting infected in that age group, and it's still underrepresented. So what we see in our data here bears out with the evidence that we're seeing from places around the world. It's an ongoing, evolving thing, but right now that still is the evidence that we're seeing.
Graham, do you have a follow-up?
Sure. So what does it mean that before September 10th, 9% of COVID cases in BC were between ages 0 and 19, but now in the past week, 12.5% are. And in Ontario, that rate has gone up to 15% from 7.8% before schools opened in Ontario.
Yeah, so it's a reflection of a couple of things. It's a reflection that we're actually testing kids a lot more. So we presented some of that on Monday. In the younger age group, we've gone and we've tested 4 times more children than we did before. And this is because we're monitoring them more carefully when they're in the school system, and we have these processes in place to make sure kids can get tested. So that's an important difference. But if we look at in BC, there's still less than 10% of the cases that we're seeing, and that has held steady. And we've also seen that they are underrepresented still, proportional to the population of that age group here in British Columbia. So I think it's a combination of things. It is reassuring that we're doing more testing, and still with the testing that we're doing right now, the percent positive is very low for children under the age of 19. So of the, it's about 7 in 1,000 who are, these are children with symptoms who have been tested, turn out to have COVID. So that's still a very low rate, and that reflects as well the low rate that we're seeing of COVID in our communities. That doesn't mean that every single case doesn't need to be followed up on, and we do what we need to do to investigate and to see where they got it and to prevent ongoing transmission. But it is a reflection of the fact that this is spread more easily in certain environments. And those environments tend to be places like long-term care homes, where a lot of people are in crowded places together. So we're not seeing explosive outbreaks since our schools have been open for a month now. But just on testing, I neglected to say, we did over 12,000 tests in the last 24 hours. So 12,052 tests, and of those, 109 were positive. So our percent positivity, and these are people who we're targeting to be tested, people with symptoms, is still less than 1% right now. So that gives us a good measure that we're holding our own in the community here in BC.
Mary Griffin, Check News.
Oh, hi. Thanks so much, Dr. Henry. I just have a question about BC Ferries for this Thanksgiving weekend. It says most of its reservations are booked for the weekend, and some of the routes like Tsawwassen, Southern Gulf Islands are completely booked. And when you've been urging people to stay home and stick with their immediate household bubbles, does this concern you? And should maybe travel again be deemed only essential travel?
Yeah, so I think we're at the spot where we want to have a balance. We know that there's still restricted numbers on the ferries, and I know there's been some extra sailings put on, but we want people to stay local. And there are important reasons why people need to or want to go visit close family members that they may not have seen for a while, and this might be an opportunity to do that. But we want people to enjoy BC and the Southern Gulf Islands, Vancouver Island, the mainland. Those are important places to go for some families. Keep your groups small. We don't want large groups traveling to places for sure, but it doesn't concern me so much. We know that there's still restrictions on numbers that many of the ferries are allowed to carry still.
Mary, do you have a follow-up?
Yes, I do. I was just wondering about some of the amateur sports clubs, especially for younger people, are suggesting that if their members go off island and then they return, they quarantine for a period, or if they're entertaining anyone this weekend from the mainland, that they be excluded from those activities for a week. I'm just wondering what your thoughts are on that.
Yeah, that's not the public health advice that we have. As long as people are maintaining their safe practices when they're around others. So if you have relatives coming over for a small family dinner, there's no reason that we would see, as long as everybody's healthy and that people are monitoring themselves when they come back or traveled. And, before they play sports every day, there needs to be that assessment of making sure that you're feeling well as well. So, those are extra measures perhaps that some people are taking, but I think what we need to focus on is having those COVID safety plans for the team. There's measures that are put in place for the amateur sports teams to make sure that there's reducing the young people coming together. They're not sharing drinks. They're making sure they're keeping distances as much as possible. We're reducing the numbers of people in the environment with the sports they're playing. So those are the things that we need to reinforce right now.
That's Global News.
I assume that's me. I didn't hear the first part about that.
Yeah.
Dr. Henry, I've received a bunch of emails about people working here in Victoria, public servants. And you mentioned at the beginning about returning to work and what workplaces are supposed to do. And there's some concern that public servants are being encouraged to go back into the office. You work in the public service. What advice do you have for that as a workforce in terms of encouraging people to go back into the workplace?
Yeah, so this is something that I know the public service because I've consulted with them or they've asked for our advice that they've been working on. So there is a COVID safety plan for each building, for each unit, and there are measures in place to ensure that small numbers of people, that we don't have large meetings like we used to, that things are still done, a combination of remotely and in the office. And there's some where it's really important to be in the office for a period of time. So all of those COVID safety plans are available, and people should be checking those. And I know there's lots of opportunities for flexibility for many groups, but some teams do need to come back together and to be, I won't say face-to-face because we don't want that these days, to keep their safe distances, but to be back in the office environment.
Do you have a follow-up, Richard?
No, that's it. Thank you so much.
Thank you. Next question is from Ethan Sawyer, CBC.
Hey, Dr. Henry. As we head into the Thanksgiving weekend, can you give us an update on when the visitor restrictions will be amended for our elders in long-term care? Many families are concerned about running out of time with their loved ones.
Yeah, and I've said this before, I don't have a timeline. We are working every day to make sure that the right people are in place to support visits and that they're being done in a way that supports families across the province. There was some inconsistencies in some places, and the focus has been on trying to make sure that it's done in a safe and consistent way, that we have all the processes in place, and I can't really say more than that other than each facility is working on this.
Ethan, do you have a follow-up?
Yeah, just a quick one. Would consideration be given to designating some family members as essential caregivers so they can be allowed to see their family members?
Absolutely, and there is a whole provision for essential caregivers. We have defined that quite broadly, and it's up to each individual facility to make sure that essential family caregivers are included in the visits and that it's done in a manner that's safe. And if people have concerns or they feel that they're not being assessed properly by the facility that their loved one is in, there is a patient safety and quality office in each of the health authorities that they can go to get support and having that reassessed if need be.
Next question is from Marcella Bernardo, News 1130.
Hi there. Happy Thanksgiving, Dr. Henry, if you don't get a chance to hear from me before then. Just wanted to ask you about education in schools again and what harm could come from the public knowing exactly the number of students and staff that are linked to exposures in schools across BC, because Alberta's already doing that, and I'm getting inundated with emails from parents who are saying, why can't we just have specific numbers about a possible exposure in our school?
There's a whole lot of things around schools, as you know, that are being followed up on a day-to-day basis by the regional health authorities and by the public health teams. That's not information that we collect on a day-to-day basis in a way that can be aggregated, but we can look at having it periodically in terms of what percentage are students versus staff.
Do you have a follow-up, Marcella?
Yeah, just regarding the confusion and the mixed messaging that we're getting about why runny noses and sore throats are no longer part of school entry checklists, we're seeking more clarity because the same rules don't seem to apply for children and staff. And while that may be obvious to medical professionals, it's not to the rest of us. And it seems to contradict the ongoing recommendations for everyone, including teachers, to stay home if you're not feeling well.
Yeah, and it is very much based on evidence and data that we have about what symptoms are associated with COVID in young people. So it is for students, and particularly for elementary school students, most importantly. And we're talking about single symptoms. So I just wake up with a bit of a scratchy throat, or I just wake up with a runny nose. That's when we know that parents know their children best. And if they're concerned, they should keep them home for 24 hours. See what happens, see if it gets worse or if it resolves, and then they can go back to school. So that's and it's based on the data that we have. I mentioned that it's around 7 per 1,000 children with symptoms have tested positive for COVID. And when we looked at what are the symptoms of those who test positive versus the symptoms of those who test negative, there's an awful lot of young children, particularly with runny noses only, who don't have COVID. And we know there are other things that are circulating right now that can cause that. And those single symptoms by themselves are not really a good marker of COVID versus other things. So it's a caution. It's where parents can make an assessment if things resolve, or if it's the runny nose that they have all the time and it's only that and everything else is fine, then they shouldn't be excluded from school for that reason. And it is different for children than it is for the symptoms that we're seeing in older children and in adults.
Next question is from Tim Ford, Victoria Buzz.
Good afternoon, Dr. Henry. I just want to keep going on this thread about symptoms with children in particular, and the possibility of maybe overlooking something. Are you at all concerned about the possibility of a parent self-censoring in the opposite way, that is to say, saying they just have a runny nose, sending their kids to school, and it turns out they did have the virus? And if that is the case, and we experience an outbreak, would you adjust your criteria and your guidelines?
Yeah, so I think what we need to think about is this is all based on data and information that we have that's ongoing. And so we have seen that there are children, lots of children in our schools with runny nose, just for example, that don't have COVID. And yes, there may be one in a 1,000 that does have a single symptom, but that would be very unlikely. And we would know how to manage it. If there was somebody who was detected, we know that it usually manifests that at some point somebody will have symptoms and need to have a test. And that's what we've been seeing. We see that happening, we recognize it, and it's making sure that we're not excluding children from school, lots of children from school, for reasons that aren't risky, aren't related to COVID.
Tim, do you have a follow-up?
Yes, just a very straightforward question. Should we be expecting an update on Monday, or will that be a holiday for you folks?
Yes, we're going to let the epidemiologists have a day off this weekend, so we are not going to be doing an update on Monday. We'll be doing it on Tuesday, slightly later, about 3:30 on Tuesday.
Next question is from Laura Brom, CFAX 1070.
Hi, I was wondering if you could tell us exactly there's lots of people who are saying they aren't wearing masks for medical reasons, so I was wondering if you could outline what kinds of medical issues somebody might have that would exclude them from needing to wear a mask.
Yeah, and you know what? There's very few medical conditions that make people unable to wear a non-medical mask. However, there are also things that may make it challenging or difficult, or for people unable, more than a medical condition. So it can be things around not physically being able to put it on or take it off, and we see that with young children, but we also see it with certain people with disabilities. There's different types of disabilities that may not be apparent to people, that make it challenging for them to wear a mask. But most of the medical conditions that people have concerns about, things like lung conditions or heart disease, we know that those are not negatively affected by mask wearing. So there's no concerns about, I know there's been things out in social media about carbon dioxide levels increasing or re-inhaling virus. Those things are not concerns around masks, but some people are unable to wear them for mental health reasons or for physical reasons.
Laura, do you have a follow-up?
Yeah, so also this week, SFU released a study that showed that if mandating indoor masks nationwide, it could reduce cases in Canada by 25 to 40%. So with that number, I know you've said previously BC isn't looking at this, but are you now looking at mandating indoor masks?
No, we aren't looking at mandating them, but we have put out the conditions where we think it is important for people to wear them, and that is those indoor spaces where you can't consistently maintain your physical distance. So we do know that masks in and of themselves are not a single thing that is going to solve all our problems, but they do need to be taken as one of the measures that can make a difference, particularly when you can't maintain those safe distances. And that study is helpful. It's what we call an ecological study, because there were many other things that were put in place at the same time, and it's sometimes hard to tease apart which ones are the ones that make the most difference. But it is helpful in helping us understand that when there's a lot of community transmission, and I think that's another key piece, they looked at areas where there was a lot of transmission in the community, where there was a lot of people with unrecognized disease who were out and about in the community, and that in those situations, it absolutely makes a big difference to have that extra layer of protection, along with maintaining your physical distancing, trying to stay away from closed spaces, etc. So we are not at a space here in BC where we have that level of community spread, but I do absolutely recommend that all of us should be wearing masks when we can't maintain our distances, particularly we're in places like transit, when we're inside in enclosed spaces where we need to be there for a period of time and we can't move around. So we're talking about like on the ferry or in an airplane. Those are things that can make a difference. The other things that are incredibly important and we know are very effective, and sometimes I hear people feeling that they need to wear a mask when they have a physical barrier. So a physical barrier is very effective at preventing transmission of this virus, and we've seen that. So bus drivers who have a physical barrier may not need to wear a mask the entire time that they're in the bus. If we're at many retail places where they have plexiglass barriers between you and the clerk, those are very effective as well.
Srishti Gangdev, CKNW.
Hi, Dr. Henry. Thank you for taking my question. I'm just wondering how much of a concern is asymptomatic spread in BC at this moment? I'm asking because Harrow Park told me last week that they ended their first deadly outbreak when they tested everyone who may have been exposed and found 4 or 5 asymptomatic cases and isolated them. And then at their most recent outbreak, they said within 2 days of it being declared that there were 10 cases and 9 of them were asymptomatic.
So there's a couple of things about asymptomatic spread, and I think what you're describing is what we're doing now for outbreak investigation, particularly in long-term care, because we recognize that people in long-term care homes may have very mild or not even recognized symptoms. So that is how we manage an outbreak in a care home across BC. Everybody within either the affected unit or the affected home is tested. The residents are tested to make sure, because we know that signs can be very subtle. So that and Harrow Park is a good example where they did what we call case finding. As soon as a single person was identified, all of the residents were tested. Having said that, more and more evidence is showing that most of what we call asymptomatic are people who are pre-symptomatic, so they're early on. Many more people, and there's just a paper that was released earlier this week that looked at this in some detail, that it may be that we're doing investigations and catching people before they develop their symptoms, and that truly people who've never had symptoms, asymptomatic spread is much less than we thought initially, and certainly it wouldn't be in a cluster. So it would be very unlikely to see this virus spread to a group of people in a school, in a workplace, in a home, with nobody developing symptoms and it just spreading widely from there. So those are the types of things that we take into account when we're investigating a cluster of cases. We do a number of tests to see who might have this or not, and it depends on the type of contact people have. But places like long-term care homes where they're living in close contact, testing of people to try and find cases before they develop symptoms is really important part of our strategy. And excitingly, we have some new testing options that have been approved for use in Canada that can help us with some of those outbreak investigation situations as well.
Do you have follow-ups, Srishti?
Yeah, I do. So I understand what our province's position and your position is on asymptomatic testing, but it does seem to contrast quite a bit with positions in other jurisdictions. For example, Dr. Fauci, south of the border, said he was very worried when the CDC's recommendations shifted away from testing asymptomatic people who were deemed close contacts of cases. And Ontario similarly faced backlash when they changed their testing recommendations. So I'm just wondering where the contrast is in the different approaches. Are they using a different kind of test than we are?
No, it's all about nuance, unfortunately. I'm learning that that's not a good thing for people, but what we're talking about are several different things. So Ontario is doing a lot of, as Alberta was, asymptomatic testing. Just everybody go out and get tested, regardless of risk. So if you are a close contact of a case and you're self-isolating, you've had a risk. And the cases that we are seeing right now are people with symptoms. So we say if you don't have any known risk and you have symptoms, we want you to get tested. And if you have a known risk, there may be situations where we need you to get tested as well. So what Dr. Fauci was talking about was somebody who is a close contact of a case who's at risk. And then testing may be helpful, but periodically. So it's not if we get a negative test today, and I think what happened in the White House is a good example of that. You can't rely on testing alone for people to be negative. So somebody needs to be tested, but we know that most people after exposure, the chance of you developing symptoms goes up between day 5 and day 7. So it takes a while before you're shedding enough virus that a test will be positive. So it doesn't make any sense if I've been a close contact of somebody yesterday for me to be tested today because it's going to be negative unless I was exposed sometime before. It takes time for the virus to build up in your blood and for it to build up in your body and in your secretions where it can be at the detectable level of our tests. And these aren't as sensitive as some of the tests that we have as well. So there's more of a chance of a false negative. But it is all about what we talk about pre-test probability. And when we look at, and I talk about these unlinked cases, they are people with symptoms. And most of the people with minimal symptoms that have been a contact of a case are ones we know about, and we know they have a risk of exposure. So if their test comes up positive, we're sure they probably have the disease. Having said that, we also get false positives, and so there's a balancing that we need to have. And most importantly, in some of those jurisdictions where they were doing a lot of testing of people who had no risk, and most of them were negative, it uses up a lot of resources. And that's unfortunately why some jurisdictions have had challenges in keeping up with lab testing of people who absolutely need the test. So our focus here in BC has been on testing people with minimal symptoms, especially adults, and anybody who's part of a public health investigation or an outbreak or cluster.
Jane Side, North Shore News.
My question is about youth sports, as well as school, kids have been back in some activities since September, things like soccer and hockey and other things. I'm just wondering if there have been any cases associated with youth sports organizations.
I believe I know of maybe one, but I'm not entirely sure. There's not been any outbreaks that I'm aware of related to sports or sports events or sports groups. As we know, there's some detailed safety plans put in, and the sports have been modified so that they can be done safely, including things like not having a lot of parents on the sidelines, making sure that kids do drills, that we're not traveling, so that we're not unintentionally bringing the virus to other areas of the province. And mostly those have been very effective as far as I'm aware.
Do you have a follow-up, Jane?
Yes, I have one, which is in a similar vein. I'm wondering about adult recreation and sports, because that's also something that's sort of been opened up more in the past couple months, people being able to go back to various recreation activities in their local rec centers, for instance. And I'm wondering if there have been any problems with that, and any sort of transmissions that have been happening, or whether that has been relatively okay to your knowledge.
Yeah, again, it has been relatively okay. We've worked with the sports organizations, and I think gyms are another place where we've seen a lot of measures put in place to make sure there's distancing, small numbers, that they keep track of who's there. I will say that from my own friends who are involved in some of these sports, that there are some that you pick a team that you're going with. Don't go to play pickup hockey with one team one night, another team another night. That's more risky. What we want to do is make sure that people are able to have that important sport in their life, but do it in a way that doesn't increase your risk of coming in contact with large numbers of people. But I've been actually very impressed by the way the sports teams, the schools, the school sports teams, and gyms. We haven't seen exposure events at many of them since we've put the COVID safety plans in place. So again, it means sticking to those, keeping the numbers small, minimizing those potentials like in locker rooms and benches. And I know many people are doing things like coming to the sport already dressed, so we're not going into the locker room, making sure you're staying apart on the sidelines and things like that. And it's working effectively so far, and we need to keep that up.
Lisa Cordesco, CHLY.
Thank you. Dr. Henry, I want to ask about a local case. A local Extinction Rebellion activist has written you a letter about his experiences after being arrested and taken to cells in Nanaimo at the end of September. Is this an appropriate place to lay a complaint, and is there anything that your office can or will do about his complaints over a lack of PPE, no mask wearing by officers, no physical distancing, and being in the cell with another person who was had a nasty cough?
Yeah, so I mean, those are disturbing things. I don't know this particular case, but I would refer them. There's an ombudsperson that they can provide their concerns to, who has an obligation to look at these issues on behalf of the correctional system. I would also suggest that the local police service, if it was a local jail, that they should put their complaints or their concerns, address their concerns to them as well. I do know that we have been working very closely with the provincial correctional services, and that they do have processes in place at all of the provincial facilities. As you know, we had an outbreak earlier this year at a federal correctional facility, and they have as well upped their ante on making sure they have appropriate PPE and processes in place. So I'm not aware of the details of this particular situation, but the ombudsperson is a place that you can go to register concerns, and the local, I'm not sure if it was a provincial facility or whether a local facility, but again, making sure that there is a complaints process within the local police services that they can access as well.
Do you have a follow-up, Lisa?
Yes. So is there a requirement for local police services or local RCMP detachments to also have COVID safety plans in place?
Yes, there is. In this province, we are requiring all organizations to have those in place, and I know a number of public safety services and policing services have been working on those to make sure that they keep their members safe and that they have protocols for their offices, for the facilities, their cars, etc.
We have time for one more question today. For everyone listening, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Rob Monroe, Info News.
Hello, Dr. Henry. The 10,000 cases we've had, roughly 4,000 of those have been in roughly the last month since about September the 3rd. So it's kind of frightening, the numbers, 100 plus every day. But when I look at the numbers of active cases compared to early September, it's only about 200 more at any one time. And the amount of deaths since September compared to before that is very small. So I'm just wondering what that says about how you're dealing with COVID and all these increased cases. It's scary, but it doesn't seem, I think you've said this before, it's not really spreading like you had been worried about earlier in the pandemic.
Yeah, every time we have cases, 100 a day seems like an awful lot. But you're right. And these are the things that we're looking at. We're looking at our increase went up slowly. It wasn't that rapidly accelerating increase that we've seen in some other places in the world. We've also seen a gradual increase and a leveling off of people in hospital and ICU, and those are things that we watch very carefully. So early on in this pandemic, we didn't know a lot about how this virus spread. We were concerned that it was spreading in healthcare settings in particular, and that could overwhelm them, and that would have effects on people in our community. We're now recognizing that this virus is definitely in our community, that we aren't going to be able to eradicate it from our community, which was also a hope that we had early on, at least I did, having worked on the SARS outbreak in 2003, where we did push that back into nature. But this virus is going to be with us for some time. It spreads between people. And it spreads between people in our community, and for most people, they have quite mild illness, and they recover from it. Some people have some long-lasting effects that we're still learning about, and we know that some people end up in hospital, particularly our elders and seniors. So those are the people we need to protect. But what these numbers tell us, and what the active cases tell us, is that we are in that balance where we're opening up the important things in our community. People are going to work. People are going to school. Yes, there's some transmission of this virus, but we're able to do that safely because we can manage those cases, make sure that it's not spreading widely. So there's things that we all need to continue to do individually, and that's cleaning our hands, wearing a mask, keeping our safe distance, staying home when we're not feeling well ourselves. And then there's things that we can do that are communal. And that means not having large gatherings, keeping our numbers so we're not traveling to places and bringing risk with us if we've been exposed to others, making sure, and this is why we've had the orders that we have around small numbers of gatherings, around some of those settings where we were seeing ongoing transmission to numbers of people that was making it hard for us to find those people, and places like some of the nightclubs and banquet halls. So unfortunately, we had to reduce those settings where we know this virus can be transmitted, what we call super spreader events. So we've tried to reduce those as much as possible. We're reducing travel because we know that having introductions from other places can tip that balance over. So right now we're in that balance. because people in BC are doing what we need to do to keep our numbers small, and public health is following up and able to isolate cases and contacts and keep them away from others if they develop illness so that it doesn't spread to that next chain of transmission. So it is a fine balance, and it's a challenging balance, and I know it's hard for all of us. We want to just be able to go back to our normal. But this weekend is a weekend to contemplate that, to recognize that we have much to be grateful for. There's many things that we can do, and we can do safely. We just need to take these small measures and small sacrifices, each of us, to get us through this next few months.
Rob, do you have a follow-up?
Well, yes, I do. In terms of keeping the vulnerable safe, going to long-term care homes, the people I am talking to, the essential visitors, is not being enforced well. They're lost. They can't get any kind of help. And they're saying that we're not the sick people. We can go in, and I know you're waiting to get more staff in there, but they're saying we can augment that staff. We can help feed people. We can help care for people. We're not sick, but they're being stymied about getting in there. So why can't some of the help be some of the family members who are very careful about their bubbles?
Yeah, and I do appreciate how challenging it is for people. Our challenges, and we can see it happening in some places, this virus is very pernicious, and when it gets into that environment, it can spread so rapidly. And there's two things about this. One is that the workers in long-term care, by necessity, need to care for all of the residents in that facility, or at least in their area. And so they do need to be in the facility safely. If we have one visitor for every single person in there, that increases the risk dramatically, and it increases the risk for the staff and for the residents in that community. So it is a very fine balance that we have to find in long-term care, and I understand that we're not there, we're not where we hope to be, and as we're heading into influenza season and respiratory season, it's going to be even more challenging for us, making sure that we have PPE to protect staff, to protect residents, to protect visitors. The downside is that when we have a slip-up, when there is an entry of the virus into a facility, it can spread so quickly and be so lethal, not just to the person that you're with, but to everybody in the facility. And so it is trying to find some balance in that risk. And we're working our way through it, and it is very hard, I know.
That's all we have for today. Thank you.
Thank you.